The other person I'd really like to introduce, because the AIDS Institute is very lucky to have him, is Carl Schmid. He's our Deputy Executive Director. He's also the head of our policy office in Washington, D.C. Many of you know him, and many of you who don't know him, I would like to say that he's a powerhouse, in our opinion, certainly in the Washington, D.C. area and nationally. He's also a very passionate advocate, and he knows his way around the HIV and AIDS arena. I can't say enough about him, but he's your moderator for today. He's going to walk you through the sessions and give you a few housekeeping items as well. So again, thank you for choosing this institute, and please again join us after lunch break for the additional speakers that we have. So let me bring up Carl Schmid. Thank you.
Thanks, Michael, and thank you all for being here this morning. What I'm going to first do is to give a little intro on why we're doing this session this morning. But I guess, well, now I'm going to start, and then we'll do some housekeeping things. So the title of our institute, as you all know, is Achieving the HIV Testing Goals of the National HIV/AIDS Strategy. So what is that? What are those goals? And so we're all on the same page. It's by 2015 to increase from 79% to 90% the percentage of people living with HIV who know their sero status. So this goal in the strategy for the National AIDS Strategy is so important that it's also included in many other strategies at the same time for our U.S. Government. It's included in Healthy People 2020, which guides all of our federal government planning and therefore a lot of what's going on in the states as well for the next 10 years on what our federal government is going to be doing in the healthcare arena. And you know, Healthy People 2020 has hundreds and hundreds of goals. But we were so pleased just last week, Assistant Secretary Howard Koh at HHS announced that this goal, the testing goal that I just talked about, was chosen to be one of the 26 leading health indicators. So again, it shows how important that is. And maybe Andrew will talk more about that because that's in his shop. And this testing goal, the same testing goal, was included as a key indicator in the National Prevention Strategy. So we're talking about the AIDS strategy, but there's a national prevention strategy, and this same goal is included in that as well as it is included in Healthy People 2020. So you can see how important this is to, I think, our government, and I think why people think it's so important. So I think everyone in this room knows why HIV, knowing your status, is so important, but just to go over that. It's important, one, to the individual. It brings them into care and treatment. And I think the reason why I wanted to talk about that is because if you're successful in getting to accomplish the testing goal in the strategy, well, let me frame that. If you're not successful in testing people, you're not going to be successful in getting them into care and treatment. So we have to be successful in getting people tested so we can meet that other goal in the strategy of getting people into care and treatment. And it's also important to society as a whole, because you know that once you know that you're positive, people are going to change their activities and do things that will not put others at risk. So that's a benefit to prevention. And that's also another goal of the strategy, is to reduce new infections. So that is why HIV testing is so important. And it's important to the National AIDS Strategy and its success. So what's the universe that we're dealing with? You know, some people say that we have 1.1 million people. I think CDC is now saying 1.2 million people living with HIV/AIDS in the United States. And if 21% of those people don't know they're HIV positive, that's around 252,000 people, 250,000 people. So if we're going to achieve the goals of the National AIDS Strategy and get that down from 79, increase it from 79% to 90%, that means we have to diagnose 132,000 people. We have to test a lot more people than that to achieve those goals, to find all those positives. But you have to remember, we have 50,000 new infections every year in this country. So that number is not stagnant, and that population is not stagnant. So we have to keep on testing and testing new people, testing the same people over and over to achieve those goals. So it's a big order ahead of us. So to accomplish these goals, it's really going to take a coordinated effort by the federal government, state government, private entities. You know, Jeff Crowley and his peers in the administration, and you heard it from Secretary Sebelius this morning. It's just not the federal government's national AIDS strategy. It's everyone's national AIDS strategy. To be successful, we're going to have to all work together. So that's why we brought together the federal government, and many components of them you'll hear from today. State government you'll hear from today. Private entities, and it also takes new technologies, and we're going to talk about that as well, and policy and program changes, and we're going to talk about that as well. So just to go over the agenda, this morning Jeff is running a little late. He has a 10:30 call, and we're going to first hear from Andrew Forsythe, who is from the Office of HIV/AIDS Policy that is doing all the coordinating for the National AIDS Strategy. Where they're going to hear from CDC, who has the lead in prevention efforts. And then we're going to take a lunch break. Now we're up against some stiff competition for lunch. And they were on schedule today. I was really surprised, but I don't know if they're going to complete everything in an hour and a half at lunch, but I hope they do. And I don't want to be in competition with Jennifer Holliday, and so we may not start exactly at 1:30, but as close as possible. And but when it's over, we will come back here, and if it's really running late, we'll come back earlier. And then we're going to hear from some other important federal partners in the afternoon, HRSA, SAMHSA, and CMS. Then we're going to hear from some companies who are directly involved in developing the new technologies and the testing apparatus. And then we're going to hear efforts to increase HIV testing through healthcare reform, state health departments, and through the private sector. And then Dr. Jonathan Mermin is going to join us at the end, who heads up CDC's HIV division with some concluding thoughts. We have in the back of the room the agenda. I hope you picked it up. We also have the bios. We're not going to bore you with reading them all. And then the presentations. We're keeping with NMAC's desire to go green, and they will be all online in the AIDS Institute's USCA 2011 website. This afternoon, we have 3 panels, and we're going to first start with our federal panels. I should say our continuation of our federal partners involved in HIV testing. And so I'm just going to introduce all of them first, and then turn it over to our first speaker. So we have 2 speakers from HRSA, and that's the Health Resources Services Administration. First, we're going to hear from Lynn Wegman, who is the Deputy Director, the Division of Training and Technical Assistance at the HIV/AIDS Bureau. And for people that don't know the HIV/AIDS Bureau at HRSA, they're the ones who run the Ryan White program. And then we're going to have Dr. Seiji Hayashi, who is the Chief Medical Officer for the Bureau of Primary Health Care, and they're in charge of all the community health centers. Then we're going to turn to Warren Hewitt, who is the HIV/AIDS coordinator for the Center for Substance Abuse Treatment at SAMHSA. And then finally, we're going to hear from Heather Brown-Palsgrove. We've done a lot. We started off talking about why HIV, the goal of HIV testing in the National AIDS Strategy, but why that is so important, because it's really going to help drive a number of other goals in the strategy to reduce the number of infections, and also how could we get people in care and treatment if we don't find people who are positive, and so testing is so important. We brought together a number, I hope it wasn't too many, speakers, from all facets of the HIV community that are engaged in HIV testing to achieve these goals and the strategy. First from our federal partners, CDC, and then from HRSA, SAMHSA, CMS. We also brought together the HHS, the overall party that is coordinating the policy. And then we said that it's not just the federal government that can do this, but it really takes, as our last panel showed us, that it's state governments, that it's private and public partnerships, and that we can't do it alone, that we need these new technologies, and I really thank the companies and for what they're doing. And then it also, as Lindsay talked about, and Patrick, that there's policy changes and regulatory changes as well that we could help achieve the goals of the National AIDS Strategy. So